Hello and welcome to Matters That Matter. Learn and teach. You're watching the PLAB series, and today we'll be speaking about the cervical smear. Hello everyone. For today's topic, we'll be going according to these main points. We'll be looking at what is a cervical smear, why do we do it, the questions to ask to the patient, how to perform the test, and as well as how to end the OSCE. What is a cervical smear? So, when you have a patient who is in front of you, you might have a few questions that you need to answer. And in these slides, I'll be going through some of the questions that they might ask and how you would like to answer them. So, it will be mainly in patient language whenever we are going to explain something. Since it is a procedure, in some OSCEs you are asked to perform the procedure, so we'll also have the steps how to perform the procedure. So, what is a cervical smear? All persons having a cervix and who are registered with GP are invited for cervical screening between a specific age group, that is the age of 25 to 64. Between 25 to 49, it is every 3 years. Between 50 to 64, it is every 5 years. Cervical smear is performed only if the previous smears were abnormal. How long does it take for you to obtain the results? It is around 2 to 3 weeks. Why would you go for a cervical smear? It is done to detect for abnormal cells in the lowest part of the womb as early as possible. When should the test not be carried out? So here are some reasons why you should not be doing this cervical smear. The reason being that it might interfere with the result quality, as well as during pregnancy, the cervix becomes softer, and hence you might be causing some abrasion, some more bleeding to the cervix because it has become softer. So when should the test not be carried out? If ever there is pregnancy, if the patient is actively on periods, or having active vaginal bleed, any recent sexual intercourse, and any recent use of spermicidal gel. What do we expect in the test? You might have different types of cells. You might have normal cells, inadequate quantity of smear, so the results will be saying inadequate. Abnormal cells, which will be in the form of dyskaryosis, and this can be of low grade or moderate to high grade. If ever a low grade dyskaryosis is noted, that may be normal, and the test is repeated every 3 or 5 years depending on the age group. As I told you, 25 to 49 every 3 years, and 50 to 64 every 5 years. If moderate to high, then colposcopy should be done, and we have to rule out cancer. What are the questions to ask to the patient? When was the last smear done, and what was the result of the last smear? This question is for two reasons. One is to understand whether the patient has already had any result, and secondly, to know whether the patient already knows about how this test is carried out, so that when you're explaining the procedure, you may ask the patient if she would like full detail of the procedure, or can you make it, or she would like to skip that. So it only depends on the patient. Don't take it for granted. You have to explain everything. If she says that she knows, then go for the test, but to give the basic minimum. You would ask for when was the last smear done and what is the result. The LMP and the menstrual cycle, the intermenstrual or postcoital bleed, previous pregnancy. If ever the patient is currently having any contraindications, as we mentioned in the earlier slide, surgical history, any instrumentation through the front passage, medical history. So in that we have to look at if a patient has any signs or any symptoms of cancer, that is if patient has flows, which is fever, loss of weight, loss of appetite, and any swelling in the body, allergy, and also screening for STD. Go on to explain the procedure to the patient. Ask the patient if she is aware about the test. Briefly explain and perform or fully explain the procedure accordingly. Check with the patient if she wishes for the full explanation or has her own questions at the beginning and at the end of the procedure. Now, how do we prepare for this test? How to perform it? It's very important to have a little time. Identify your instruments, keep it on the side, and then you start. So you will have a trolley time. What you can do is, while you're explaining to the patient that she needs to lie down in a certain way, or you would like to um, tell the patient to undress, or you're arranging for the chaperone, during that time, you might think about what you're going to assemble in your trolley. It is important to also make sure that you have a good light source before starting the procedure. Now, what are the things that you would need? You would need a pair of gloves. Cusco speculum, cervical brush. You might need the bottle, which can be of a short path or thin prep. And you would need to label it, so always keep a pencil or a pen with you. Few wipes, a lubricating jelly, and the clinical waste bin. Also, do not forget that you have to sanitize your hand prior to beginning the procedure before wearing the gloves. So the trolley time can come after having explained the procedure to the patient. So how would you explain this procedure? Before smear sampling, always take the consent of the patient. Tell the patient that you will be having a female chaperone with you, and ask the patient if she has any pain before and during the procedure. So you need to check for her comfort. And also inform the patient that this test will be consisting of inserting a plastic device. It's best to show the device to the patient into the vagina and taking a sample from the neck of the womb. Reassure the patient that you will be gentle, but the test might be slightly uncomfortable. Another point to be added is that after the test, the patient might experience slight bleeding, spotting. That is also normal. Now, prior to starting the test, ask the patient to empty her bladder if ever it is full, and undress below the chest till mid-thigh. During that time, give the patient privacy. And you would also ask the patient after she has undressed, she would lie down in the modified lithotomy position. That is, the heels are close to the buttocks, and let the knees fall on each side. Um, During this time, while the patient is undressing and getting into the proper position, you might arrange your trolley at that time. Now, perform the procedure. Wear the gloves, do a quick inspection, look at the abdomen, whether it is normal, any distension, any scar, visible pulsation, any dilated veins, any visible peristalsis, vaginal bleed, discharge, any obvious mass or swelling in the groin. After you've inspected, you would need to lubricate the blades of the speculum. Warn the patient before inserting the speculum. And then with your left hand or your non-dominant hand on part the labia, and with the right hand, you would need to insert the speculum. So when you're parting the labia, you need to see whether the cervix is seen, whether the os is closed, and there is no bleeding. Now, when inserting the speculum, it's very important that the blades should be closed, and you're pointing the handle of the speculum to the left. Then you would turn it 90 degrees and carefully open and inspect it. So you can point it upwards or downwards. Don't forget to use the screw and keep the speculum in place. Now insert the brush deep enough and rotate clockwise 5 times. You need to count the rotation in your head. That would be the best, and you're being observed during this time, so don't fake this scene. Now that the sample has been taken, what should be done next? This step is very important. Carefully remove the brush without touching any other surfaces, because that would lead to contamination. Now, depending on which one you're preparing, whether you're preparing thin prep or short path, there are 2 different ways of obtaining the sample. Now, if you're preparing thin prep, then you need to dip the brush such that the bristles are separating and allowing the cells that are trapped between the bristles to come out. So you need to dip the brush 10 times into the bottle and shake well, then discard the brush in clinical waste bin, tighten the cap, label, and send to the lab. Otherwise, simply drop the brush in the container in short path, tighten the cap, label, and send to the lab. Of course, the stick is to be thrown in the clinical waste bin. How would you end this OSCE? Warn the patient before closing the speculum and removing the speculum. Look for any bleeding. Provide wipes for cleaning and tell the patient that the procedure is over. Thank the patient and give the patient privacy to dress up. Another point I would like to make is for the labeling of the sample. You can do it at this point when you're asking the patient if she could dress up. So during that time when you're giving privacy, that is the time you can do the labeling. And after the labeling, ask the patient if they have any further query, if they are feeling any pain, discomfort, or excessive bleeding. And it is always good to end any station with some safety netting. Click on the like and subscribe button if you enjoyed the content. Till next time, have a nice day and take care. This is Matters That Matter.